So thanks to everyone for participating today. I'm looking forward to a really good and lively conversation. So I'll kick it off. Hello and welcome to CCR on Fertility's virtual discussion. The theme of today's event is Where You Go Matters. My name is Dr. Laxmi Kondapalli. I'm a reproductive endocrinologist and infertility specialist at CCR Fertility in Colorado. I'm excited to lead today's discussion on selecting a fertility clinic that's right for you. If you're looking into exploring options for fertility treatments, it's important to understand that where you go really does matter in terms of your overall likelihood of success. And unfortunately, not all fertility clinics are created equal, and we will have our guests kind of share their experience as they've gone through the fertility journey. We will soon be joined by Dr. Bill Schoolcraft, who is the founder of CCRM Fertility and the medical director here in Colorado. But first, I'd like to introduce our other panelists and guests. First, I'd like to welcome Molly Bloom to the discussion, and many of you may have heard of Molly Bloom, particularly in the movie Molly's Game. In addition to being an entrepreneur and a speaker, Molly is really an advocate for patients and women specifically, looking into fertility care and really doing their research and homework and identifying the best clinic. Molly, I'd like to introduce you to the discussion.
Thank you so much for having me. And, I speak about all the time the things that I wish I would have known. And because we've gone down this road and had this journey, and there is a learning curve, and there is sometimes such a difficulty in mining the right information and the right decisions. I have definitely made this a part of my platform and using that platform in a way to educate women of all ages looking at all these, possibilities, from if you're in your 20s and thinking about freezing eggs to trying to get pregnant in your 40s, or looking at markers of your fertility in your 30s. I think there are so many things that are just kind of grossly under discussed and can really empower women. So I'm about this. I'm super excited to be here on this panel with all of you awesome women, and looking forward to this discussion.
Yes, well, thank you, Molly, for participating, and thank you for being such an important advocate and voice for patients that are going down this pathway. Next, I'd like to introduce Dr. Hala Sabri. Hala is a well-respected emergency medicine physician who struggled with infertility before finding her way to CCRM. In addition, she's also the founding board member of the Physicians Moms Group, which is an amazing online community for female physicians that are exploring fertility options. Hala, welcome to the panel.
No, thank you so much. It's just such a blessing to be here. I didn't always speak up about infertility. I was one of those women who really defined myself with my success. And when I hit what I perceived as failure, in IVF, I really went through a lot of spiral, and I think that mindset sometimes of infertility patients of kind of not really just feeling lost, like, this purpose in life that you're building for yourself. And it's something that you can't study harder for, you can't buy your way out of. And I think especially for, physician women, I think we're just so used to like really being those gunners and like kind of A-type personality. And all of a sudden, this diagnosis or these treatments like kind of stop you in your tracks. And I did 7 IVF cycles before coming to CCRM. And my 8th one was a charm. And I did 3 transfers after that 1 cycle. And I have 5 children through that. I have 2 sets of twins. And the other part that I actually talk about is not just, about the process. And I understand it so fully, not only as a patient, but as a physician as well. So I think that it's a kind of a unique situation to have a doctor be a patient, always, but I think especially when, I'm in the emergency department and I'm seeing pregnancy all the time, and I'm seeing failures all the time. I'm seeing miscarriages, and I'm delivering babies, sometimes in cars and in elevators. And I think it was just a really unique situation. But I think what I really concentrate on now is not only that process of like those feelings of frustration and kind of helping patients navigate where the best places are to go for them. But I also think that we all often put our life on hold. And then when you get onto the other side, it's almost like you were in a vacuum for a while, and then you almost have to get to know yourself again. And I think especially for women that are professionals, not just physicians, but any woman professional, I think it becomes a couple of more years that takes them to kind of wade through that, like, what the heck just happened? You know, and you've went through this really traumatic experience. So I have dedicated a lot of my platform to not only normalizing the discussion about infertility, but specifically for women professionals, and to let them know, like, please don't put your life on hold as you're going through this, and just build that legacy that you're already starting. And so I'm here to empower, you know, all those women that identify with my story.
Wonderful. Well, thank you for the work that you do and being that.
Thank you.
Absolutely.
Yeah.
And then I'd also like to introduce Tasha Blasi to the panel. I'm excited that Tasha is joining us. She is a fertility coach, a patient advocate, and the founder of Fertility's Unite Project, where she really empowers women to have a safe and healthy pregnancy in the most efficient manner. Tasha, I'd like to introduce you to the panel.
Thank you so much. And sorry, I was having technical difficulties. I think we're all set. But yes, so great to be here. I'm what you call an IVF addict at this point. I did 10 rounds of IVF to have my 2 children, only 2. I don't have 20 or 40. And it was my 10th round of IVF, technically my 9th egg retrieval and 10th transfer, where I went to CCRM, and then my Mila was finally born. And so now I have a biology chemistry background, and what I discovered much after Mila was born was that there is a formula for success. And of course, it starts with the right science. And so that's what I do. I put together this formula of 4 things that everybody needs to do to get in the state pregnant. It can't just be one of them. And so, yes, this is my life purpose, and I'm working with women all over the world, making sure that they never, ever, ever have to go through what I did.
Wonderful. Well, thank you for the work that you are doing. So I'm excited to, continue the conversation. And at this point, it looks like Dr. Schoolcraft has joined our panel. So welcome, Dr. Schoolcraft.
Can you see me and hear me?
We can hear you. Yes, thank you.
Okay, great.
Yes. Dr. Schoolcraft, we just launched our discussion about where you go matters. And I'd love for you to start off the discussion by sharing some of your thoughts about the factors that someone should consider when selecting a fertility clinic for them. And what do you think are some of the things that patients should look for?
Well, I think in general, just a fertility clinic, there may be different criteria. If you're looking to do a basic evaluation and maybe low-tech treatment like IUI, many sort of local neighborhood clinics probably do that very, very well. I think the separation really gets significant when you're talking about specifically IVF. And I think around the country and maybe around the world, as fertility experts, we probably do most of the same basic testing. We probably do ovulation induction and intrauterine insemination in a very similar way. But when it comes to IVF, although we use virtually the same drugs, it's called FSH, and we do egg retrievals very much the same way. The lab environment is a 5 or 6 day period where the eggs and the sperm are outside the body, and that can make a huge impact on whether the patient has a viable embryo to transfer. Of course, chromosomal screening, freezing and thawing add extra stress to the embryos if those aren't done well. So the lab is really the big sort of delta or game changer between clinics. I would add at CCRM, I think we are very thorough because we tend to see a lot of patients who've been elsewhere and failed. And so we take the perspective of if someone's failed 2 or 3 or 4 times, we better be very compulsive and thorough, because we may only get one chance with that person. She may be down to her last try, and we've got to get it right. So I think we take a very thorough approach to evaluating all the reasons why a person wouldn't have success with IVF and try to correct those before a cycle. But our lab is something that isn't equivalent at every center. Every center in the US, which there's over 300, has a unique and different IVF lab, for better or worse.
Great. Yeah, thank you for that. I agree with you. I think to piggyback off of your comments, I think the other thing, Dr. Schoolcraft, is that, as being a colleague of yours for the past almost 7 years, what I've witnessed is that we have a comprehensive program. So everything is contained within our practice, which I think gives patients a sense of confidence in their treatment as they're going through from the point of meeting us for the initial consultation to their evaluation to ultimately their treatment. So they have, we have genetic counselors within our practice that patients have access to. We have support counselors that will help shepherd patients through the process. We have dedicated nursing staff. So I think those are some of the unique factors that kind of set us apart in shepherding patients through the process. Molly, I'd like for you to share a little bit more about your experience in terms of your fertility journey, and you I think pursued treatment at another clinic and ultimately came to CCRM. Can you share a little bit more about your?
Absolutely. So at 36, I froze eggs, and I did what I thought was due diligence on where to go, and all my fancy friends in Southern California were going to this place. So I went to this place and thought I had this insurance policy, and of course this technology can't give anyone 100% insurance or 100% insurance. But I really thought I had gone to the sort of, this top tiered place and I was good. And I focused a lot on my career, and I focused a lot on untangling some messes in my life. And at 40 years old, I met my husband and said, okay, let's get it going. And none of the eggs were viable, which was devastating. I mean, absolutely devastating. And so from there, I did some more research, and I was, on the East Coast at the time, and I went to another place that was came highly recommended, and I did 2 rounds there, and basically, I was getting 1 blast per round, and they were abnormal, and it would retrieve a fair amount of eggs, but those eggs were not, growing to a blastocyst stage. So at that point, the reproductive endocrinologist said, I want to talk about other options. And I just said to myself, this is one of the most profound things I will ever do in my life. And I'm not ready to give up yet. And so then I did kind of what I call my deep dive into due diligence. And I started learning everything I could possibly know about this. And there was also kind of this, I had a couple friends who said, go to CCRM. I went to all these other places and, all these very sort of like highly recommended top tier places. And there's just this word on the street once you get to this place that CCRM is kind of the miracle maker. And I wanted to know why that was. So then I started to look into the science of everything and how critical that process is of labs, and saw that CCRM also does so much testing in-house and has years of those results and is able to, have that as reference. And then, so I said, before I start to think about other options, I'm just going to meet with Dr. Schoolcraft, And I met with him, and, he was very honest and balanced. And, I said, I want to try this. And on the first round at CCRM, I had 6 blasts. That's a 6-time improvement. And the only change in it was that I was older, and that I went to another lab. And so then, and I'm older now, I'm 42. I don't have great eggs, but because each time I do a round with CCRM, we're getting 6 and 7 blasts, I've got a shot, and we're getting there. And it occurs to me so often how easily it sort of would have been to just give up. because that was the advice I was getting, and those were the results I was getting, and I thought I was doing the right thing. And so what I just feel extremely passionate about to women of all ages, like I said in the intro, like if you're thinking about freezing your eggs, if you are thinking about waiting to focus on your career, if you are in your 40s and you have a lower chance, you have to go to CCRM. You have to go to this place in which the emphasis are on the labs and the science behind it. And it's not just my experience. Since I've sort of started this journey, this story has been told over and over and over. I went to these other places, had no results, and then went to CCRM and got real results. So I think I know it's the most important choice that I made during this journey. I know I wouldn't have gotten there had I not gone to CCRM. And so, I feel extremely passionate about being a voice for making this choice,
Yeah, thank you for sharing that. Hala, I'd like for you to comment as well, because you, as you mentioned, had done 7 IVF cycles before you found your way to CCRM. Could you speak to kind of making that decision about getting a second opinion, maybe switching IVF clinics? Because I do think that there are some patients that have done treatment at a particular clinic, and they may feel a little bit hesitant to switch clinics, especially if they haven't had good success, and having that optimism that seeking a second opinion might provide a better outcome for them. So Hala, I'd love for you to share your thought process during that time.
Yeah, I think it's like a perfect subject. I think as IVF patients, you become so loyal to the first doctor, or even, any doctor that you're part of, like you become so loyal. And I think it's really hard to break up because you're making a family with that doctor. It's just so intimate. It's not like any other field. In my opinion. And so I think it's really difficult to navigate that. There's a lot of emotions. It's not an easy decision to leave and to start all over again, especially when you are, I don't think it matters what age you are. I think that when you start into the infertility world, like every day counts. You're like, oh my gosh, another month and I'm going to be this old, and you start counting, so I think you almost become like really neurotic about it. Now, when I started, I was 29 years old. So I was pretty young, and nobody in my family really had any infertility problems, So I remember I was in residency and I was talking to one of my senior residents who started having children a little bit older than I did, and she did IVF. And, I was starting to try, and she's like, oh, when are you going to have children? I said, well, I'm trying, which is like the infertility code word that, it's not working, so like you just like kind of know that definition, right? And so she said, well, why don't you go to the place I went to? It's fantastic. And, a doctor's referral, I don't care, what you say, a doctor's referral is bar none the best, right? And so she said, I even referred, this other doctor there, and, she has twins as well. So I was like, hey, I'm going to have twins then. So I went to the clinic, and, lo and behold, I did IVF the first time, and there was no twins. There was no pregnancy. And that happened 5 times. And each time, I was, looking for that hope, like what's going to be different next time? Like, what's the answer? And I was almost hoping they would find something wrong so they could just fix it. I'm one of the many patients with unexplained infertility, although I think I have decreased ovarian reserve. That's my personal thing, but I think that that's kind of what happened. And so I think finally at the 5th time, and we were doing them back to back, and I'm a medical resident. I'm not sleeping. I don't have the money. I racked up a lot of money on credit cards. I was super miserable, pushed away all my friends. And finally my husband and I looked at each other, and I was like, I think we need to go, and I was on infertility boards at that time. And every time I was on an infertility board, I would see a thread named CCRM girls. And I was like, what is this? And I would click on it, and I would just see thousands of women commenting, and they would put their statistics at the bottom. And many of them were, I mean, almost all of them were older than me and had more, you know, what I considered severe problems than I did. And so I was like, wait, if it's helping all these people, like, why can't I go? But then I was, you know, had the mind drama of like, oh my gosh, I don't have money. I can't take time off work. I'm a resident. They don't even want you getting pregnant normally, like without IVF, you know? So I was, you know, really nervous about it. And I remember, you know, my husband going like, why don't we just go? And I was like, you know, I don't know. And I started thinking like, okay, well, why are they so great? And so the way a doctor investigates doctors is probably very unique, but I started, you know, looking up Dr. Schoolcraft, and I'm sorry, Dr. Schoolcraft, I totally probably know way too much about you, but I started looking up, like what conferences were out there. And I started looking up REI conferences, and I started looking at topics. You know, these are conferences I literally can pay to go to, you know, and so I started looking them up, and who are the keynote speakers, and what are the trends, and what are the themes, and who's doing the teaching. You know, as a physician, I really respect academics, you know, and I think in the CCRM world, I think that, I mean, in the infertility world, I think CCRM is the academic institution personally. And I have a lot of reasons why I think that, but I started doing this investigation and you know, started kind of looking at, you know, who you trained with and who else, you know, who else came out from that program, and asking more friends. And so I ended up not going to CCRM. I went to another clinic, and because I thought, you know, well, this is going to get me closer, you know, and it's still in Los Angeles. I'm like Molly, I'm from LA. And I went and I told myself, like, I'm not getting married to this doctor. Like, he's getting me pregnant. I'm not marrying him. I'm not having a baby with him. And I'm only doing 2 cycles here. And if it doesn't work, then it doesn't work. So I set a boundary, went through it. Although I got really close to, you know, having success, I had a miscarriage at 5 weeks, and I really respected the clinic, and I really respected the process. It hit that 2 cycle, and I was like, you know, and so I sat down with my doctor and I said, you know, I'm going to have to break up with you. And I told him we're getting divorced. And so he said, it's okay. I still want you, you know, to be pregnant. I know Dr. Schoolcraft very well. We all trained together. Of course I knew that because, you know, my PI skills. And so he actually called over, and I made the appointment with Dr. Schoolcraft. And we did 1 cycle, just like, I think Tasha said that, or maybe Molly, or both. You know, I think at this point, and I did 1 cycle, and I remember asking Dr. Schoolcraft, like, what do you think the problem is? And he said, I have no idea. He's like, on paper, you look like you're so easy. And I'm like, oh, great. Like, I'm paying how much money to find this out? And he's like, well, let's just do 1 cycle and we'll find out. It's either your eggs, his sperm, or your uterus. And then we'll just change it out. And I was like, you got to be kidding. But, you know, I think that simplicity, and I really appreciated it, because I think that simplicity, especially speaking to another physician, I think sometimes like we get into our own heads, you know? And so we did that. So we were curious. So we did an experiment. We did 1 cycle. I made, just like Molly, 6, you know, normal embryos when I couldn't get more than like 2 before. And that was like a good cycle. And 5 of those 6 became babies. So yeah. So thank you, Dr. Schoolcraft, for my family. I really, really mean it. So thank you.
You're most welcome. You haven't aged a day since I met you.
I got younger. What are you talking about? And the fact that you remember me out of thousands of people either means I was really neurotic or just amazing. I don't know which one.
Good story.
Hala, thank you for sharing that. And I think it takes courage to break up with your fertility doctor, because, you know, as a provider myself, you develop such a close relationship that's pretty intimate with your patients. And it can be really hard, especially if you've been with a provider for a number of cycles, to, you know, think about making a shift and pivoting and trying a different clinic. Tasha, you also did IVF cycles at an outside clinic before you found CCRM. I'd love for you to share your experience and, you know, how you had the courage to seek a second opinion and come out and see us.
Yeah, I was at 3 before I went to CCRM, and I was in New York at the time. Now I'm in LA, girls, and Hala Sabry, but and so I was like, I had heard of CCRM, but I was 33. It was my husband's issue. I was super cocky, right? I didn't need to go all the way to Colorado to do this. And on the second round of IVF, I had my son. So it was fairly easy. And then, right. And so I was just going to do that same thing. And I'm not going to name names of all the famous like New York clinics that I went to, though I want to badly, but I won't. But, you know, basically after my son, which I just went a year later after he was born, they like not 3 more rounds, not even a positive pregnancy test. And they kept on doing the same thing. And I'm like, there's something up, figure it out. Right. Nope. So I broke up with them. I don't have a hard time breaking up with boys. So it was totally fine. And then I went to another very famous New York clinic, you know, 3 more rounds, lovely doctor, nothing to show for it. So I left again. And then I was at another famous New York clinic. And I was just like, I was pissed, but I was also really hopeless because there was, you know, as Hala was saying, I just wanted somebody to figure out what was wrong with me, right? My husband had those sperm count, but he had 4 million. It's not like, you know, it was fine. And I had a baby before and I could not even get pregnant, even another chemical. And so that was like, please find something wrong with me. Nobody could. Another round. And so then finally it was like, what am I doing? I've heard about CCRM. I know that they're the magic makers. I need some magic right now. And I met with Schoolcraft, Mr. Personality, you. And I was, and again, like, what's going on? He's like, I don't know, you know, you're a little bit older, like, and then you told me I was maybe going to be like one of your records. I was like, okay, come on, stop. That's not nice to like say I'm holding the record for the most rounds of IVF. But I'm kidding. It was funny. But then he basically said like, let's give it 2 tries and see what happens. And my experience of the whole thing was wonderful. It was a wonderful experience. And anything outside of New York is a wonderful experience. Just kidding. But it was a wonderful experience. The doctors, the staff, everything was wonderful. And I only always got 2 embryos. And I got 2 embryos. And this time they were genetically tested. And for the first time, because everybody was like, you only get 2, like, don't touch them. Let's just put them in, which is a red flag. That means they shouldn't touch your eggs or your embryos to do genetic testing. But both were normal. And so, you know, I'm my oldest. Both are normal, and 2 girls, and both went in, and Mila came out. So this is 1 egg retrieval, 1 transfer, and 10th transfer, and it worked. And yeah, I could just like cry. But that was my experience of, you know, and going back to like picking a clinic. You know, Schoolcraft was talking about if it's like you're doing IUI and you need diagnostic tests, you don't need a specialized clinic. I would argue, well, 2 things. 1, if you're doing genetic testing, there's very few clinics you should actually trust with that, because that's a specialization within a specialization. But 2, I always look at it as if I had done my fertility journey right from the start, I would have had more options. Right? Because I always did another egg retrieval. I did 9 egg retrievals and 10 transfers. And I do have 2 children. I always thought I wanted 3, 4. I know I'm insane. Sorry, Hala, but seriously. But like, but I ran out of options, right? And I feel like, and I don't think that's great to be injecting yourself with that many drugs that many times. So as much as you maybe don't need to go to the you know, I do feel like you should always choose the best, even if it means you're commuting, you're taking off work, you're traveling, because that inconvenience fee is a lot less expensive than 10 rounds.
Absolutely.
Yeah. And by the 10th round, what happened to me, but you know, I was revived, is you lose mental health and energy before you run out of time and money. And you just can't do it again. So that's why I say, I wish from the start I did it right, because I would have set myself up with options. And it's perfect. I have my 2 perfect children. They're amazing. Look at Schoolcraft. That's Nina. She took 10 rounds for a reason. Yeah. But yeah, that's what I think. Like, if I would have done this right from the start, I don't think I would have ever needed 10 rounds.
Yeah, thank you for sharing that, Tasha. I think you brought up a really important point that if you could go back in time, what pieces of information would you have told your younger self? Or now all of you have powerful platforms where you are having access to lots of women, lots of patients that are going through this fertility journey. What would be your, advice to folks that are starting on this pathway to kind of avoid having to do multiple treatment cycles and maybe finding the best clinic to optimize their success?
Do you want me to answer?
Yeah, Tasha, why don't you
Okay.
start? You started the conversation.
Right. So really, the formula really is you need the best science. You need the best lab. Absolutely. This is the laboratory science. Somebody very smart told me, Dr. Schoolcraft, is a laboratory science. You need the best lab. And science. That being said, I think another big piece of it that women forget is the doctor's role is all about the ovaries and the uterus, right? And the sperm. And we as patients also have a big role in terms of what got us here in the first place. We were meant to reproduce and stay alive. So why aren't our bodies cooperating? And that is where I say go with the best of science, because that's going to be very costly, time, money, mental health, energy to get wrong. But also understand there's a second part of it, which is how can we create enough space and energy to actually have enough resources for ourselves and grow a baby to make our physician's job so much easier. Because I know for me in New York City, crazy stress, and now I had a little toddler, I did not have enough energy. And that's not anything the doctor can provide for you. So that combination of am I as healthy, naturally, hormonally balanced, with knowing how to restore my energy as possible, combined with the best science. And that's really the formula.
Mm-hmm. Wonderful. Thank you for that. Hala, I'd like to invite you to have your comments about what advice would you give folks that are starting on this pathway?
Yeah, so, I'm always giving advice. I mean, I'm in the emergency department. I see a lot of women come in who have miscarriages, or, they really think they're pregnant and they just really want a beta. And so they'll come to the ER because, we're open and we see everybody. And in addition to my platform on social media. And so I think that, the common themes, are a lot of what, Tasha said. I think, I am a scientist first and foremost. And so I, kind of help patients kind of understand how to read that science. Every hospital and every clinic in this world claim to be the best at something, and I think that they shouldn't stop that, because I think that that's, if you don't believe you're the best, then you're never going to strive to even be better or to keep that standard up, So from a quality standpoint, it's really hard for the patients to kind of really understand what's the best for them, and I think that it's not, this IVF is not a one size fit all, for every single patient. I mean, clearly there are so many clinics that stay open because they have success. If there was a clinic that didn't ever have success, they would not be open because people would just not go there. That would be what happens. But I think that, in addition to making sure you're as healthy as possible, I really focused on that a lot, and I was like, oh, I'm going to run every day. I'm going to try to lose weight. I'm going to do all these things. But in reality, I don't know if the science there is 100%, accurate, because there's tons of people that have varying medical problems, varying BMIs and things like that. And they beat the odds, right? I mean, they don't really fit into the mold that all of the studies show. But I will say this is that, through my process, one of the things I started to realize is that, mindset is really important. And I think, as an emergency medicine physician, I'm so used to cause effect, antidote, like what is going on here? Here's a medicine for that. And I started kind of stepping back and realizing, why do some patients do really well with infertility? Why do they do really well with cancer or any type of ailment? And why do some don't? And I don't know if I can hang my hat on, oh, they're healthier, or they eat more kale, or, they don't eat gluten, or whatever it may be, because I don't really believe that. I think it's mindset. And in fact, it's such a small field of study that we're just now, starting to break into. In 2017, Stanford did an op-ed on mindset and putting out a plea for for medicine to look more into this and to do more studies. There was one study in BMJ in the British Medical Journal that was on mindset and kind of showing, versus placebo and actually mindset work about how patients actually do better. And it has to do with their relationship with their doctor. And I think that Dr. Kondapalli, you kind of mentioned that it's going to be impossible that, a doctor sit with a patient for hours on end, but you do have a lot of resources at this clinic to help, hold the hand of these patients at every level. But I also think that the individual work of, understanding mindset is really, really beneficial for patients in any disease, any ailment, any treatment. And I think that, that's something I started delving into, and I actually started studying, and I went to a life coach school. That's like a year-long, program, and understood the cognitive behavioral therapy of our mind, and that we think that our circumstances create our feelings. Like, oh shoot, like I have to do IVF, I'm a failure, I'm sad, I'm broken, I'm whatever, fill in the blank. But actually it's not that. It's your thoughts about the circumstance. The circumstance is neutral. Someone can say your FSH is 15, and some people are like, oh my God, that's amazing, it was 20 last time. And then somebody else can think like, oh shoot, it was 8 last time, what the heck is going on, right? So it's just a neutral circumstance, right? And so kind of helping these patients with mindset. And so I've been doing a lot of focus on, women, successful women, professional women development overall, and like the little things that keep us from actually excelling in our lives, whatever that may be, whether it's professional, whether it's like, IVF or whatever it may be. And I do have a lot of IVF clients, and it's so interesting. I just got like another email yesterday about one of the women who is this amazing, she's not a CCRM patient, but she's an amazing executive for a branding company. And she just messaged me. We did a whole bunch of, mind work, and she just messaged me yesterday, I can't believe I'm pregnant. And I can tell you, like, I'm just so happy for her. And just the fact that she actually has the capacity to continue with the mind work throughout the pregnancy. And that's something that I think that IVF patients, they get pregnant and they think that that's the result that they want. Right. And they don't realize that there's a lot of months to go on with a lot more mindset work. And then when you have a baby, even more so. And so, really like helping prime that brain early on really decreases a lot of problems, later on, like postpartum depression and stuff like that. That is, kind of what's hinted in these studies. But I would love to do studies on just that, and compare women who do get life coaching throughout this process and throughout their pregnancy, and kind of outcomes, not only on success on infertility, but also other factors, such as postpartum depression, preeclampsia. There's some studies that I was reading in my last pregnancy of like the thoughts of like impending doom are linked to preeclampsia, severe preeclampsia. I had that, last time, because I went to go transfer my last 2 embryos, really to just close out the process, because I really didn't want to throw them away. And I remember they were like my poorest 2. And I remember Dr. Schoolcraft telling me on the transfer day, like, hey, like, I don't really know if these are going to work. And he's like, I think one of them will work, but I don't think both of them will work. And I was like, good, because I actually don't even care if I'm pregnant. He's like, what? And I said, yeah, I'm completing my infertility journey. I want no regrets. If I have the capacity to take care of 2 more children, that would be a blessing. But if it doesn't happen, you know what? You gave me 3 more children than I ever thought I was going to have. And he was like, all right, I've never heard that before, but lay down, let's do this. And then a couple weeks later, I'm pregnant with 2 little girls, and they're crazy. So yeah, it's good.
Oh, thank you for sharing that. I agree with you.
Yeah.
Mindset is such an important component, and that self-talk is really important, both on a positive level, because it can help sort of self-motivate patients to continue to go through these type of fertility treatments. So thank you for sharing that. Molly, you started your journey with egg freezing in your 30s, and can you think back and say, what would you have told your younger self if you could roll back the clock?
So many things, for sure. Like, so many things. I think there's been a lot of wisdom that's been shared on this, and I absolutely agree. Number 1 for me would be to go to CCRM first. That's not like just a shameless plug. That is just such a results-oriented answer. And when you try to go on the godforsaken Google to try to get this information. The top 20, 30 hits are just clinics doing, you know, sort of posting information to lure people into thinking that, you know, to like, it's clickbait. And it's so difficult to do this research on your own. And so number one, absolutely. I think that if I would have frozen, I had great fertility markers at 36. I was extremely fertile. The women in my family are extremely fertile. I think if I would have gone to CCRM, those eggs would have been viable. And I think I would have gotten better advice on, you know, to freeze more and just to bringing more science into the process. So that is absolutely the first thing. Mindset is a huge thing for me. You know, I was an athlete you know, I skied for the US ski team, and I did so after having like a pretty life-altering surgery and reconstructed back. And so building a strong mindset and a calm and being able to become aware of that inner narrative and manage that has been you know, just an incredible resource my whole life. I have a daily meditation and breathwork practice because I think the more you can get a hold of your physiology and reduce stress in the body, the better results you're going to have on every level. Another thing for me is to become your own advocate and to learn about this science, because that gives you more control and more security in a very like in an environment that's very difficult to control. As soon as I started looking at the stats and going, okay, science says that, you know, 10 to 20% of my eggs are going to be normal. And this is how many blasts we're testing per cycle. I understood it. It's a numbers game now. And so it wasn't just this thing where I was like, oh my God, it didn't work again. You know, like going through that emotional roller coaster, I was like, does the science make sense? Are the statistics making sense? You know, making the decision on how many embryos to create, getting those numbers, and just and following the science and math as much as possible, and having that be the anchor into reality, as opposed to just the emotional turmoil that this thing can toss you into. But you know, all those things aside, if I hadn't done work on my mindset, if I hadn't done work on becoming healthier and eating healthier, which was also showed to be effective for me, I still think CCRM would have worked. So that's fine. I think CCRM works despite, you know. Definitely number one is going to CCRM. But again, like I think there's a lot of wisdom in what Tasha and Doc and Hala shared about making sure that you're doing your part, both body and mind. You know.
Yes. Thank you for sharing that. As a segue, based on what you just said, Molly, what I want all of you to address is that it sounds like all of you have traveled out to Colorado for your fertility treatment. So can you talk about, what would you say to a person who says, gosh, you know, I am looking to go to the best place, but it does require travel. How disruptive was that for you with professional lives, with families, with partners? Can you talk a little bit about that and maybe demystify the barrier of travel to seek out the best care? So Molly, if you can start off that discussion.
Laxmi, before she does, I've got a patient waiting. I've got to jump off to talk.
Okay.
Who's been waiting a while. I apologize, but I just want to, before I sign off, I just want to tell the three ladies on this conference, Zoom, whatever we call it, you know, it's humbling to hear your stories. I'm kind of the mad scientist. I think Tasha kind of referred to me with my dynamic personality, but you know, when I walk in the room, you could just see the wheels grinding. I kind of attack every case, like, what can I figure out that's being missed? How can I get this lady pregnant? And it's a big challenge, but you know, I never get a chance like this to sit back and hear the whole story. And besides you guys being very brilliant and in your own careers, you have incredible tenacity and endurance. The only reason you have kids is because you never quit. But but to hear that story in real time it's still compelling to me, and it makes me have new appreciation when I sit down for a patient as to really what they go through, especially 4, 5, 6, 8 cycles. So, you guys are the reason you have your kids. It's your endurance and your tenacity and your fortitude, and I just would congratulate you all on that. And I hope more than anything, that's an inspiration to whoever watches this video, that people realize quitting after 1 cycle would have left you all with no children. So anyway, it's inspiration to hear you all talk, and you did it so eloquently and succinctly and provided great advice for the patient. So I appreciate it. Thanks for being on, and Laxmi,
Yeah.
I'll let you continue.
Sounds
So,
great. Thank you, Dr. Schoolcraft, for your insights. We
Thank
appreciate
you.
it.
Thanks, Dr. Schoolcraft. Okay, what was the question?
Molly, I was asking about
Traveling to Colorado.
travel, and if you need, if you need to seek advice or go to a clinic for the best care, how feasible is it if you live across the country? And what advice would you have for a patient who's saying that might just be a barrier for them?
Yeah. Well, I want to be sympathetic to what people's real life and real-time barriers are. And so what I'm about to say, this is not the sort of answer for everyone, but the way that I had to approach this was, what are you willing to do?
Mm-hmm.
What are you willing to do? Is this on a scale of 1 to 10, how important is this to you? And it was a 12 for me,
Mm-hmm.
That said, it's Colorado. It's awesome.
Agreed.
You're not like going somewhere terrible. It's a very beautiful, incredible place to visit. It's not that much time when you break it down. You can do outside monitoring. You can wherever you live. So for the, for the first part of the cycle, you don't have to be in Colorado. I think you have to be in Colorado, correct me if I'm wrong, 5 to 7 days.
Mm-hmm. That's
And then
right.
you go, right. And then you go home. And I think, is it the easiest thing to do? No, but in terms of a barrier, I think if you just make the choice, look, I'm going to do what it takes to get there, and I'm going to do it in the most efficient and intelligent way that I can, so that I, like you said, I'm going into my 8th round of IVF too. So that I don't have to pay this immense emotional and physical toll. Because you're right, that's what goes first. You get to this place where you're like, I'm not okay,
Mm-hmm.
And you have to take a break. But I think that I think it's the choice that you make. What am I willing to do? And then like, cool, like another reframe, right? Like a mindset reframe. Cool, I get to go on vacation in Colorado for 5 to 7 days. Like, it's beautiful there, and I can drive to the mountains, and I can be in nature, and be just be in a cool new place, or maybe it's not new. And so once you make that decision, you just make it happen. Like, we're so resourceful,
Right.
and it's that like mental trepidation that is the like hardest part to overcome. And once you overcome that, you just make it happen. You make it work. That's not to say that everybody can do that, but I think, if there's any way possible, what's more worth it than this?
Mm-hmm. Yeah, thank you for those comments. Tasha, how would you address that if you had, a friend who said to you, gosh, I don't know if I can make the commitment to travel all the way out to Colorado for treatment?
Yeah, I mean, I work with clients every day that I have this conversation with, and to Molly's point, it is tricky because everybody has commitments, their jobs. Like there are some people that cannot travel, but it goes back to the cost of this, and it's going to. And typically when I'm working with somebody, like nobody works with me when they're like, really having a great time on their fertility journey. So they've already had a lot of failed rounds, and I just bring up, this is the time to make the move, because we've already seen what this has costed you, and we don't want this to continue. And so, yes, there is an inconvenience cost. There are actual financial costs to it. But in the long run, you will save money, and you will save time, and you will save mental health, and you will save energy. So to Molly's point, you don't have to be there that long. I think a lot of people think you're there for like 3 weeks, right? I get that a lot. They're like, I can't live there. I'm like, wait, it's like 5 days. But yeah, I think there's misconceptions with that. But and again, this is a very privileged way of thinking about this. But when my husband and I went there for the egg retrieval, we just stayed with a friend of a friend. Mm-hmm. When we went there for the transfer, we made it like a very fun vacation, right? And we stayed at the very nice hotel there. What is it, Ritz or Four Seasons, something that's in town? And listen, I kind of sound like a jerk saying this, but like, it was like, I'm going to do this up. This is my time. This is my transfer. I'm going to splurge. And so I also treated it like a vacation. Like Molly said, like it's Colorado, it's beautiful. And we celebrated for our transfer.
Fantastic. I think that goes back to what everyone was talking about with mindset. It's having that appropriate mindset going into the treatment, maybe seeking this care, and not seeing it as having to travel to do this type of treatment. And then Hala, you have children at home and going through additional embryo transfers. Can you speak to the travel piece and seeking care in a state that outside of where you lived?
Yeah, it's not as hard as your brain decides it is. I think when you make it a priority, you just make it happen. And I think it's funny, we don't think twice about, I've seen people, purchase dogs in North Dakota and live in California, and they don't think a thing about it. They don't think, oh my God, that's so many state lines, but for some reason, when it's coming to make your own babies, it becomes like a barrier, but I think that, what Molly and Tasha, touched upon, it is financially, it's not buying a dog. I mean, how much is a dog? Well, I don't even know how much a dog is because I haven't bought a dog in a long time, but I'm pretty sure it's not what I paid for IVF. And I think that there's some people who really, honestly, cost is not, that is truly the limiting factor. And if they won the lottery tomorrow, this would be their first, investment. And, the advice I give them is a little different. And I think because I'm so aware of the intricacies of our healthcare system. And, one of the things I was going to do if it didn't work out was I literally told my husband, that I think we should move to a state that has like mandated IVF coverage. Yeah. I mean, what's the big deal? I mean, we're young. We don't have kids to uproot. I mean, I lived in New York for medical school and then went to California. I could move back to New Jersey or Florida or, somewhere that has mandated coverage. And so that was going to be our plan. And I think that for people who are limited by finances, I think being scrappy like that, I think it really benefits them. And it just goes to the tenacity that Schoolcraft touched upon when he was, talking to the three of us. I tell my clients, like, you already are a mom because you are thinking about it. You are thinking like a mom, and you are thinking about how much more you can sacrifice, for your children. And so I think that for me, I didn't really have tons of barriers. I was already done with residency. I did make good money. So I was able to like save money and to make travel not a big deal. But just like, Molly and Tasha, like my husband and I took it like a vacation. And I will tell you that, I'm sure Dr. Kondapalli, you see tons of like, partners and, for people who do have partners or, and they're in a marriage, pretty sure there's like a lot of like tensions that you see, between them, because it does add strain to marriages. It's kind of like buying a house. My realtor has always been kind of like the referee, in some ways. And I feel like sometimes like that IVF doctor is the same way, and so I think that we just decided it was going to be, just like what Tasha said, like, we're going to start celebrating the making of our family. Like, what more exciting, how much more exciting is this? And we've always done our transfers around, events in our lives that were really important to us, and so we would use it as a celebration. And my best memories with my husband, I mean, we've been married for almost 13 years, and my best memories have truly hands down been our retrieval in Colorado. And I will tell you, like, it's the one time that we unplugged We were there. We knew that we were really investing everything that we could for this family of our dreams. We did, you know, some hiking. We ate a lot of pho. We went to like whatever that expensive mall is, and we like walked into every store, you know, and just got to know people in the area. We went house shopping. Like, I don't know, we did anything possible, you know, because it was just us, you know, and I took the time off work, and it was hard. It's not like it's the easiest thing. I kept it super on the down low from work. I had to take some time off. I chose to spend 10 days there. I didn't want like the drama of like, you know, going to another clinic. I already had some trust issues. So I really wanted everything done at Colorado. And I think, I don't know if this is like part of Schoolcraft and Surrey's plan when they made the clinic, but I think it's brilliant to put it in the middle of the United States, like where you could fly from anywhere in about 2 hours, you know, and get there. So I've literally flown there and flown back the same day. I felt like such a rock star, but you know, I mean, you got to do what you got to do. So I think for me, I tell patients like, you know, that, well, they're not my patients all the time, but they're clients, you know, that, you know, I think that that's a mindset issue. That's a thought. It's not a belief. It's not a fact, you know. We've traveled for things before. And if anything, when you start to address your limiting beliefs, like the sky's the limit. And you start to become that tenacious, like scrappy, you know, mom that's going to fight for your children.
That's
so,
great.
Yeah.
That is right. Well, thank you for sharing that. And thank you for bringing up the fact that we are fairly accessible. Like Denver, Colorado, you can get to our clinic in a pretty quick period of time. Even if folks are traveling from the East Coast, they can usually find direct flights. So I do agree with you that the central location is very, very helpful. As we are closing up our discussion today, what I'd love for each of you to provide is any last minute thoughts or advice that you would have to participants that are watching today. And Tasha, why don't you kind of lead off?
Of what Hala said, but you get to choose to be a mom, and you don't get to choose who shows up. You don't get to choose when and how they show up, but you do get to choose if you're a mom. And then there's just the details on how to get there. You got to get in the game, right? You got to make it happen, do whatever. But I think if somebody would have just told me, it's going to happen, for me, it's going to happen again. Because you've decided you're having at least 2 children. So it's done, right? So relax, knowing it's done, not relax enough to not make any moves or take action, but it's done. It will happen. You have a uterus, you have eggs, you have sperm. And now we just need to kind of trust that whatever is happening with you is for a reason. And also remember that that little nugget also has a say in terms of when he or she shows up and in what accessories. So that is what I would tell anybody on their current journey.
Thank you for that. Molly, if you could share some final thoughts.
Yeah, well, Tasha, that was great to hear, because I am still in the process, you know, and I still do need to kind of continually reframe. And even with the medications and everything, like instead of being frustrated about how many times I have to inject, instead having gratitude for the science that has gotten us here and that is giving us a chance. So I think a ton of work on mindset. I think surrounding yourself with a community of people that are positive and possibly going through similar journeys is hugely powerful. I think it's in so many ways, it's the most powerless I have ever felt. And the things that I have done to take power back and to have agency, like doing the research and making those choices and, kind of walking into the fear and making the choices, even though they really didn't make sense for my finances or for my lifestyle, and just like sourcing out people who have had success stories, so that when I'm having those days that are really hard and it feels like I'm not going to get there, reading those testimonials. I have I have a whole file in notes of people's testimonials, because like Tasha said, like, you're going to get there. You're going to be a mom if you've made this choice and you're willing to do whatever it takes. the challenges is how do you stay sane and mentally healthy and enjoy your life during the process. So I think that is one of the biggest things to focus on, and even having a gratitude practice. Like there was a time where I was, you know, COVID had just come out and I got, and my cycle was canceled, and I click, you know, the clock is ticking and whatever, the eggs are dying as I'm talking or whatever is happening, that that I had to like have a gratitude practice and check in with that 3 times a day and just be like, I am so grateful that I'm at CCRM and that I'm getting results. I'm so grateful that, you know, my husband and I are willing to like put stuff on credit cards and, you know, sort of have to, you know, that we're just figuring it out. And it really did change my mindset over time. So I think, you know, doing whatever you can, reaching out to a community to stay hopeful, and learning about the science and learning about the numbers and kind of letting that be a huge guide. And, you know, I always say this on my social media channels, like, I'm here. I know that, you know, the other women are too. Like, I'm here, reach out to people that have made this their platform. If they're about it, you know, they'll respond. And I always respond to women that have questions about this or that need support or whatever, because it's so important and it's crazy to go through. And
Yes.
having the right people around you makes a huge difference.
Yes, thank you for that, Molly. And I'll echo what Dr. Schoolcraft's sentiments were earlier, that all of you have displayed such incredible strength, because it does take a lot of tenacity, strength, and motivation to kind of move forward with treatment. So thank you for sharing that. Hala, any last thoughts?
Yeah, you know, I think you know, now looking back, and I'm done having children, and you know, looking back at the process, you know, I'm still committed to making this part of my platform, because I think when I was going through it, I felt really you know, a little bit deserted, I guess, if that's lack for a better term. Like I would make these IVF friends, and then, you know, they would get pregnant and lap me, you know, you know, have multiple children. And then all of a sudden, like I was part of their past, and it was a little bit too traumatic for them to even talk to me, because I think that they hadn't dealt with their mindset about what they had gone through, and maybe even a little bit of survivor's guilt of some sort, you know? And so I think I felt like really like deserted and abandoned. And so for me, I think, you know, to touch upon Molly's point about community, I think, I mean, community is everything. I mean, this is what I do for physicians. And I'm part of, you know, CCRM communities on Facebook, and I still check in once a month, and I comment and I read and I, you know, offer support, because I needed that when I was going through it. I will say that there's 2 things I tell people. One is not everything's always going to be positive. You know, life in general, outside of infertility even, is 50-50. Truly. And the only reason why we know what happiness is because we are comparing it to sadness. And so no matter how much strife or despair that you're going through in this process, just know like that's going to be part of your evaluation of, you know, success on the other side. And so don't try to like avoid it or resist it. Like feel it in that moment and allow yourself to be vulnerable. Because I tell you, it will make you a way better mom down the line, a better friend, a better colleague, a better mentor, a better everything. The other thing I always tell people is like, just be open, be curious. I remember when I was starting to try to get pregnant and it wasn't happening. I mean, and I was like, not one of those people that was like leaving it up to chance. I was like, I had all the ovulation kits. I had read all the stats. I knew like the beta numbers. I knew everything. Like I was like a little neurotic about it. But then, you know, I remember, you know, someone had told me like, oh, like, why don't you try, you know, IVF? And I was like, I'm never doing IVF ever. Well, like eat my words, you know, 8 times later, you know. And I remember through the process when I met Schoolcraft and he told me like, oh, the problem's either your eggs, his sperm, or your uterus, and we'll just change out the variable. Like, I was like, what? Like, no way. Like, we're having a kid this way. And I think I started to become a little bit more open. Like, well, what if? Like, what if I did donor embryo? What if I did gestational carrier? What if I looked at these other options? Because the goal is to have a family. And that looks a lot of different ways. And there's different methods of acceptance through a lot of people. And so I see often with my clients that they'll start off going like, I am never doing this. I'm like, okay, like we won't touch that right now. And like a lot of them end up going to have like, donor embryos and things like that, things that they said they would never do. And I think just, if you just stop resisting the possibilities and just realize that your eye is on the prize, you are a mom already. We're just trying to figure out the logistics. You're going to get there. And, whether that's, with your own embryos, with, donor, which, are yours because you've adopted them, or adopted children or whatever it is that your family looks like, it's going to be perfect. And I wish one of the things I did was journal more. Like I'm a doctor. I hate writing, so, I do it a lot more now, but the little journaling I've done before, like I like looking back and remembering her, because she keeps me grounded. And I tell, my oldest is 7. And when I tell them the story of their birth, because they always ask on their birthday, like, oh, were you at the hospital? And I start the story from before. I start the story from like, hey, there's this doctor named Dr. Schoolcraft and Dr. Suri. And actually my daughter is named, my daughter's named Suriana after Dr. Suri. And I tell her about them all the time. And so she knows about CCRM and it's such a beautiful, rich story, that I don't want to take away from their history, because they truly are miracles from love and science. So yeah, if anybody ever needs anything, like Molly said, I answer every single DM I get. And you can reach me on Instagram, Facebook, or drhalasabry.com. But yeah.
Wonderful. Oh, thank you so much. What an amazing conversation this afternoon. I want to thank all of our guests that provided their candid insights and really important advice to all of our audience. So thank you, Hala, Tasha, Molly, for participating in today's discussion. We also thank Dr. Schoolcraft for his words and his insights and advice about selecting the right fertility clinic. And as we've all discussed this afternoon, selecting the right fertility clinic is such an important choice, and it's such a huge a huge commitment, that doing your research and really getting all of the information is such a critical part in putting a person in the best position of being successful. So thank you again, everyone, for participating this afternoon.
Thank you.
For moderating.
Yeah, absolutely.
Wonderful.
And
Molly and
chiming
Tasha,
in
you guys are
here-
amazing. I just want to say, Molly and Tasha, I've never met you guys before, but you guys are
Oh, you too. Oh my gosh.
It was a great conversation, and I think like it's so awesome to hear sort of your perspective and outlook, and like see that you got there, both of you, and like hear your wisdom. Like it's super valuable, and I think so many people are gonna I just benefited from it huge.
Yes,
Okay.
yes. Because I think it gives people who may be in the throes of their fertility struggle that there is a path forward. And I think, Hala, when you said that there's so many different ways of making a family, at the end of the day, that is the goal. And that's one of the things that I tell patients too. There's lots of ways of having your family, and we just have to think about what's the best option to get you to that successful outcome.
Yeah. I mean, even if people just leave it in their back pocket as like a Hail Mary, I think that's fine. I mean, I know it's not ideal for most people. They have these ideas of how their family is going to look like, and it changes drastically, about, once you find out that you're going through this IVF route, so I think it's really challenging, it's a lot for people. I mean, for me too, speaking personally.
Yeah, I think that this forum was really helpful, especially for high-functioning professional women, because you represent that population of women who have, worked really hard in their life, have made all of the right decisions, and it's very, very frustrating. And one of the conversations that I have with patients is that infertility is out of your control. It is a medical condition. We have evaluation, we do a diagnosis, and then we have treatment options. And it wasn't anything, a choice that you made or didn't make, or anything that, was within your control to, face this. And more people are facing it. So I think having platforms as you all do, I think helps normalize it for folks, especially for professional women, to be able to talk about it.
Yeah, because my friends and I all waited, and I have way more friends that had to do it through IVF than not. And so like, being empowered is great, and, wanting your own career is great. But like, I think we have to educate that your eggs and your reproductive system isn't necessarily like as advanced and as much of a feminist as you are. You know what I mean? Because we all waited, you know, we're like, oh, whatever, like everyone, you can get pregnant, because you see like the celebrities that get pregnant when they're like 46 or whatever. But so I think that like looking at those markers, the AMH, and even though they're limited in scope, but like looking at follicle count, looking at AMH, like what after, you know, in your 30s or whatever, is also really important to add into these discussions, because, you know, my friends and I all had problems. Like we've all had problems. I was so overconfident. I was like, I have like 11 eggs, no problem. You know, I just didn't know anything. And the advice I was getting at this place was like a turn 'em and burn 'em, like, you know, very fancy waiting room. But
yeah, and I kind of felt like I was always like a puppy mill, you know,
yeah,
at like other
totally,
places. And
totally.
you know, and there's a lot of shame that goes along with it, you know. But I will say that, you know, I know that IVF was a decade of my life, you know, and I don't regret it at all, because I will tell you the benefits, besides like having children, the benefits of that is I've learned a lot about myself. But honestly, I will tell you, I've learned how to be a better doctor through that. Like to the point, and it's not just because I'm a woman, but like whenever somebody comes to the ER and they, you know, are having miscarriage, they're like, oh, Hala, you know, and it's not because I'm, you know, a woman, but it's more like, you know, I have a shared experience and I know like what not to say to people, and how to, you know, be honest in a really gentle way, and to kind of, you know, I've just seen it a lot, you know, and I've been through it. So I think, you know, if anything, I just assume that it was purposed in my life to, you know, let me speak about it. And, you know, same with Molly and Tasha, I would never have met you guys before had I not had that experience. But yeah.
And I always say to my clients, and just for myself, you know, I was a biology teacher, chemistry teacher in Santa Monica. Then I went into advertising in New York City, and it never seemingly made sense, my life. Now I'm doing my life's work of helping these women, you know, get pregnant a lot faster. So would I wish my fertility journey upon anybody ever? Like, no. And I never thought about doing this. This was somebody else's idea. But I look at it back as like, Molly, you're in this, you've already had a few journeys, but you're now in this incredible journey, and it's not ordinary, it's extraordinary. And that's your life. You have an extraordinary life, and that's what you want. You know, so for me, it's like, I don't want a linear life and be like everyone else and be normal, as much as that's all I wanted, right, growing up. And so you can also look at it this way. I don't know why it's so hard for you. I am going to DM you after this and give you some things, but I don't know why it's so hard after this. But if you look at the big picture of this is another extraordinary part of your life, and it's going to work out really, really well for you.
Thank you. Thank you.
It's true. It's just that.
And then I might want ordinary, because I'm tired, girl.
Remember,
okay, I get that. Yeah, I get that.
I remember when I had you know, Molly, I don't know if Tasha, you went through this too. I remember when I was going through my transfer that was successful at CCRM, my first one, and I had my daughter, Suriana. You know, I was like, you know, just super happy, but I really wanted to experience that joy again. I wanted to be pregnant 3 times. I don't know why, but like, that's something that I wanted since I was younger. So I want to be pregnant 3 times. So when I went back and I had my second transfer, I remember I was more nervous than the first time. And I remember Dr. Schoolcraft going like, why are you so nervous? Like, you've already gone through this before, and, you know, you've been successful. And I was like, because I thought I knew what it was like to be a mom, but now I know. And I think that secondary infertility is such a special population. And I think that the processes that you think about, because it's more than just wanting to complete your family, because it's about your child and what does that mean for your child? And especially as we're older, I'm 42 now, you know, and so as we're older, we start thinking about our own mortality and things like that. And so there's a lot of things in the background, even if we don't think about it in the forefront of our brain, like we're thinking about it. And I think that the risks that we perceive in our brain are a lot higher. And so oftentimes I see women in that respect is, you know, just like, well, what am I going to do? Like, I don't want an only child, or I don't, like, that's not what I wanted for my family, even though there's nothing wrong with that in any way. But they put a lot of pressure on them. And I think that that's something just to be cognizant about and really talk through. And sometimes our brain, when we don't want to deal with things like that, we start thinking about like the hows, like, oh my God, what's my count and what's like my medication? And you start thinking of things that you think you can control, you know, even though you really, if you step back and you look at your mindset, that's probably a really good place to start. And I'm definitely happy to talk to you in if you ever need anybody.